Hi there. It's Gabriel, and I am in the Hampshire College Library. Um, Luckily, there's not a lot of people here, so I can kind of get away with talking, even though I'm kind of like in the stacks, which are very expensive looking stacks. A lot of woodwork here, um, which, it's a nice library. I'm a fan of libraries. But without digressing too hard into that, I'm going to talk today about the medical pharmaceutical complex. So, most medicine for most of human history is centered around plants and diet and a lifestyle a little bit. They used to try to cure people who couldn't see very well by going on a long sea voyage, so your eyes would adjust to looking far distances. They used to try to cure heart issues by sending people out from the city into the farmland or Midwest, whatever you want to call it, the mountains. And Edgar Cayce did a lot of work where he talked about diet, or he channeled dietary recommendations to help with, most conditions. Max Gerson did as well. So there's the whole Eastern medicine philosophy, which doesn't use pharmaceuticals or chemistry very much at all. So there's a lot of evidence that other things besides pharmaceuticals are effective for healthcare. I've seen a lot of evidence that the side effects of pharmaceuticals are not really worth it, so I'm just going to rant a little bit about that. So we didn't used to have a shortage of primary care physicians in our country the way we do today. And that was because there was no standardized national healthcare education. It was all just based on your reviews, how successful you were. You could be educated any way you want, and anyone could claim to be a doctor, really. Obviously, that's changed. And now we have MDs, holistic medicine, or MDs. There's different medical degrees you can get. There's family practice physicians, MDs. I don't remember the rest of them, but it's not the way it's always been. So there was a huge turning point in the early 1900s when the Flexner Report came out, and there's a lot of focus on health because a lot of people had gotten medical exemptions from serving in World War I. I think 25% of people didn't end up being drafted because of medical exemptions. And people actually, I don't know why that was. It could have been that industrialization was making people worse health-wise. I can only speculate, but there was a huge shift when the Flexner Report came out, and they were very clear that they thought there could never be a shortage of primary care physicians, and that it was well worth standardizing the education of doctors so that essentially doctors would not have such a hard time getting patients. So really what they wanted to do was drive up the wages of doctors and make a shortage, or make it, make them less accessible. But they got one of the people who were involved with that. Some of the people who were involved with that were named things like Drake and Morgan. And Drake is a root word, same root as the word Dracle, or Dracula means of a dragon. And the Morgans are, or maybe it was the Lobes. No, I think it was the Lobes, or the Coons, one of them. anyway, one of the big banking families was involved in the Flexner report. And then Jordan Sather always talks about how our medical system is built, it's like the Rockefeller medical system where it's, being produced by the same people who have done, really sad, corrupting things to our government and society. The oil barons are not the people who we want to be running our healthcare system, because like oil itself is like making our planet sick, and then on top of that it's like those are the same people who are like suppressing Tesla's technology. They're concerned about money, and you can see that today with pharmaceutical companies whose biggest priority is profits, unfortunately. So yeah, that's a big driving factor in vaccines, where they're the most profitable thing in pharmaceuticals, sales portfolio, which is sad because our government's mandating them, and it's like just essentially a tax on people and a tax on their health as well. So the Flexner report comes out, and then we see a kind of a transition into more laboratory-based chemical, like really pseudoscience, where you need to get the FDA to approve your drug unless you have the money to bribe them, like Merck does, or the CDC. All these organizations that are supposed to be promoting the interests of people and making sure pharmaceuticals are healthy and doctors are practicing medicine well, they've been shown to not really be doing that at all. Sorry, I kind of got ahead of myself there. So the Flexner report comes out, and then we start to see a gradual transition towards more hospital care. Initially, more attempts at like surgery. The first vaccines start coming out. We start to see like just the industrial production of medicine become more utilized. And by all measures, it doesn't really make people any healthier. There were certain changes in like hygiene and diet that probably are more to do with why people are healthy. And yeah, it's really frustrating because at this point, we've seen a huge rise in the healthcare industry. And that rise has been driven, most of our spending is in hospital costs and end-of-life care and pharmaceuticals. And we don't need to be spending any of that money. And if you look at countries in Central America, their healthcare industry centers around primary care and diet. And it works better. And if you look at a country like Japan, they've banned vaccines, and they also have better healthcare outcomes. So we're not really taking the best, we're not really analyzing ourselves very well. And we could definitely be utilizing our healthcare data better as well, because under Obamacare, we incentivized all these healthcare records to be created, and we're not really using them for the benefit of patients. Consulting companies are doing the majority of the work. It's not really being done in-house in hospitals. So there's minimal institutional knowledge gained and minimal amounts of change that can be made based on knowledge we glean from the records. And then there's the fact that our government has a huge hand in this, because they are paying higher costs than other governments are, specifically for pharmaceuticals and hospital care. And then that's creating huge inflation in healthcare costs. And it's bankrupting people, and it's going to bankrupt our federal government, and it would have already, except that we can borrow infinite amounts of money from our Federal Reserve And that inflation is just really a tax on people's wages that they don't see. So it's really just like because of healthcare, taxes have gone up, bankruptcies have gone up, health has actually gone down, and it's actually more stressful now to get treated because of it. So yeah, there's obviously a lot more to say, but those are definitely some overarching thoughts that, yeah, we could do a lot better. And even just looking at other countries is a good place to start. But then on top of that, it doesn't take much understanding to see that profits are driving people's decision making. And, you know, you could also make the case that a depopulation agenda is driving people's decision making. And yeah, that's my view. I think that when Bill Gates talks about all of his philanthropy going towards population control, there's some real issues that I have with the way that business is being done. There's probably more I could say, but I think that's a good way to end it. It's just like, you know, the vast majority of the money we spend, it's not really being used to make us healthier people, which is sad. So, you know, learning about other forms of medicine can be really valuable. And learning about lots of different stuff, you know, investing in yourself and your education is really important. So with that, I'm going to say goodbye, and I'll see you soon.